Hello and welcome to this episode of The Pure Pod, a podcast brought to you by Pure Sports Medicine. My name is Tom Ritchie and I'll be your host. Today we will be talking about sustainable weight loss in light of recent developments and the proliferation of weight loss drugs such as Ozempic. And we'll also be kind of just looking at more sustainable and healthy ways of losing weight and whether those drugs can play a part in that. So to answer those questions, I'm joined by Clemence Cleave and Tom Williams. Clem is an award-winning nutritionist with expertise in weight management, women's health and cardiometabolic health. How are you doing?
Tom. Hello, I'm really well, thank you very much.
And Tom is Pure's head of performance, strength and conditioning coach. He's passionate about building solid health foundations for his clients that will last for a lifetime. Does that sound about right?
Yeah, pretty much. Not as many as awards as Clem. Not quite award-winning yet, but try my best.
Try harder.
Yeah.
No, I think you're pretty good at what you're doing.
So, as I said, I think the best place for us to start this conversation really is to talk about GLP-1 agonist drugs like Ozempic and some other drugs that are out there on the market. I think maybe it would be useful just to kind of talk about what the original use case for these drugs was and when they entered the market and how they've become so popular. So, Clem, I don't know if you...
Okay, so originally these drugs were used to treat type 2 diabetes, and they started to be used in early 2000s. And then, as they were used for type 2 diabetes, they realized that there were weight loss coming through this, and then so in 2010s more research was done around actually dealing with obesity, and so they became really popular in the just recently during 2020 20 and 2021 is when they really started to take off. But funnily enough, a little anecdote, we secrete GLP-1, but it has a very short lifetime, so a matter of minutes. And originally, the way they discovered the power of GLP-1 was through observing the Gila monster. So it's a lizard, and the Gila monster could stay without eating for a very long period of time, days. And so they looked at what was going on in his gut, and they realized that he was secreting GLP-1, but for much longer, for hours, days, in a way that we couldn't do that, and that's how they discovered this.
I did not know
drugs.
that.
I think it's quite cool.
Yeah, no, that is cool. And so so you said it kind of got popular around 2021. Tom, was that around the time when you had clients coming in to you and asking you about these drugs, or did it take a little bit longer for that to happen?
Yeah, I think they first kind of manufactured them for treating obesity. I think it was around about 2017, 18, and then they hit the mainstream, I think, after COVID. And yeah, I actually remember I had a client come in, long-term client, and he said, "So what are your thoughts on Wegovy?" And I had no idea. I think he'd literally read it in, I don't know, the FT or something that morning, and I had no idea. And I was really skeptical because I think, like a lot of people, when you hear something that seems almost too good to be true to begin with, you kind of turn your nose up at it, and you think, there's no way it can be doing what it says. But actually, since then, it's obviously snowballed more and more. And definitely last year was the year where, I started seeing people come in specifically because they're on the drugs. And at the start of this year, it's kind of increased more and more. So it's probably 5 years or so, where it's now everyone kind of knows about it, right?
But you're absolutely right. But at first, there was a shortage of them. So first of all, there was a bit of suspicion around them. But then after, a lot of people wanted to be on them and couldn't, either because it's quite hard to get them through NHS, but even privately, you had struggled just to get hold of it. So I had clients who kept starting and stopping just because of supply.
There's a problem, right, for the people who had diabetes and actually need it from almost like a life and death situation, to people who might be using it just for more aesthetic purposes, and those people that needed it couldn't get hold of it. Thankfully now that seems to have stabilized a little bit, and actually there seems to be a bit more control over the demand and the supply.
So I think it might actually be useful for us just to kind of detail how these drugs actually work, like how long are they in your system and what are the effects it might have on you?
So first of all, at the moment, it's an injection. And you inject this peptide, GLP-1, and this is going to, and they mimic an hormone that you secrete in your gut called GLP-1, and there are many of them, many different variations of them. But I mentioned that we secrete GLP-1 naturally when we eat protein, when we eat certain fibers. But the half-life of the GLP-1 that we secrete is very short-lived, matter of minutes. These GLP-1 drugs actually last days. So you will inject yourself on Friday, and then they will have an effect for up to 7 days, for some people even longer. And yeah, the effect that they have is, first of all, they have an effect on your sense of appetite, so your sense of hunger. You feel full quicker and for a long period of time. They also slow down the speed at which food will move from your stomach into your small intestine. So that as well gives you a sense of fullness. When you eat, the food stays longer in the stomach, and that as well mechanistically send a signal to your brain, say you don't want to eat anymore. So they play in different aspects, mechanistically and chemically, just to get that sense of not feeling hungry.
Yeah, basically, just building on that, basically makes you feel like you've eaten a full Christmas turkey, even if you've just had half a sandwich.
Exactly.
So you feel absolutely stuffed for the next few hours,
yeah.
And you might not have eaten anything at all. And in the US now, and probably I imagine towards the end of this year, they are releasing them in tablet and pill form
daily.
as well. So you can do daily pills rather than a once a week injection, which I think will only increase usage and probably make it easier to get hold of as well as time goes on.
And that made me think that it might really be useful as well for the maintenance phase, because that's the problem. A lot of people expect to take these drugs whilst to lose weight, and then they can't wait to stop. They're not meant to be stopped. And that's why we see the weight regain. And how do we do the maintenance phase effectively? Well, we don't have much data yet. But we know that if you stop, you gain the weight back. Up to 2/3 of the weight loss is regained after a year. And so we really need, even when you've had lifestyle intervention, unfortunately. So yes, we can do a lot of work to improve your diet quality and your behaviors around using these drugs to help you phase them out. But thinking that you can live without them forever is probably unrealistic. How do we, today we say, you probably need to be on a lower dose. So once you've reached your weight, you titrate down to the dose that enables you to, at the lowest dose that still enables you to maintain your weight loss. But maybe we extend the cycle, rather than having an injection every 7 days, maybe we spread it out. Some people are talking about microdosing, all of that. I think we're going to see guidance emerging to really help with the weight maintenance, but that is still a bit of an unknown.
Yeah, my kind of take on it is that if you consider it the same as something like statins, right? So statins are dished out to lots of people in the population to reduce blood pressure and cholesterol or whatever, and actually that is something people are quite happy to take for the rest of their life. Okay, and there are things you can do in terms of exercise and diet to reduce, the blood pressure and etc. But actually, still taking the statins is still worth doing, and I think that's the same with these drugs as well, right? And these medications is that we absolutely 100% should be doing things such as exercising and improving your diet to make sure we're making the lifestyle changes and giving us the best shot we can by our own means, but actually using these long term, at least for now, it doesn't seem to be.
So we need to remove the stigma around
Yeah.
it. So there's
Yeah, and it's a
because
sickness,
there's
isn't it?
there,
Like any other
yeah, exactly. And but I think it's another big issue at the moment is that we still live in a society, like you mentioned, where there is a lot of stigma around obesity and around using these drugs.
I mean, obviously, it has become like a real hot button topic in the media over like the last 2 years, and there's often quite a lot of black and white thinking when it comes to these kind of products, I think, right? But I think it'd be interesting to hear from you when you think it is appropriate or when you think it can be used well for people who are just trying to manage their weight rather than somebody who obviously needs it for diabetes. So when would you recommend somebody actually explore using these products?
So for me, so at the moment you can get it on the NHS if you're, I believe, if your BMI is 37 or higher, and you have at least 2 comorbidities as well. So something like pre-diabetes, high blood sugar, or high blood pressure, etc., etc. These are really, really good drugs. There are some risks and some side effects to them. For me, if you're someone who the risk of staying at the weight you are, or the fitness level or health level that you are long term, if you're someone then that who poses really high risk to, basically mortality, if you're at really risk of dying too young, then actually it's worth taking those drugs. If you're someone who actually your BMI is probably okay, you're just trying to shed a few pounds for maybe aesthetic, or you got a summer holiday coming up, that kind of thing, then actually the risk of taking them outweighs the benefit. So for me, it's if you've got a high BMI, if you're in that overweight, obese category, it's something you should consider doing, especially if you've tried other means of losing weight as well, because a lot of people who are in that category, it's not through lack of trying. Obesity is a sickness, and like any other sickness, it gets to a point where actually you should use the medications that are there for you, and then even more so if you're someone with metabolic syndrome, high blood pressure, high blood sugar, all the kind of comorbidities that come with being severely overweight.
And I think what you're saying is very important. We talk about weight loss drugs, but they are obesity medications. And like any drugs, there is some risk. It's not risk-free, and it's all about risk benefits. And I also think it's important just to think of what obesity is. Obesity is a health condition. WHO and in Europe, it's considered, even I think in the US, it's considered to be a disease. In the UK, we haven't made that move yet, but it is, the definition is that it is a chronic, complex and relapsing condition where excessive body fat increase your risk health-wise. And so whether you mention cardiovascular disease, type 2 diabetes, but I would also say mechanically, maybe you can have a problem with your joint, you can have obesity, really can undermine your health. So you need to think of what are your risks of not taking it, as well as whether there are risks coming with the drugs. But it is a drug, and you should be quite cautious when you take it. So the skinny jab, as some people talk about it, I think really undermines the fact that we're dealing with health conditions here, and it should be done carefully with the supervision of healthcare professionals.
Yeah, I think obesity and being severely overweight is treated slightly differently to other sicknesses and things. There's an element of judgment that comes with it as well. Yeah. I think as a society, we're probably quite fattest, and we think that actually those people who do fall into that category just need to try harder or look after themselves a little bit more and do the right things, eat less, move more, and that kind of stuff, which we know. We know more now about what causes someone to be overweight than we have done before. So it's not through lack of knowledge, but actually obesity rates are still rising. So something needs to change, because otherwise, that kind of life expectancy is going to drop, and those conditions and strain on the healthcare services and et cetera, is only going to continue to snowball. And these medications provide real scope to be able to start managing that, as Clem says, if prescribed properly, correctly, and under correct supervision.
Right, with the right wraparound care.
Yeah, exactly. Yeah.
Because it's just one tool.
Yeah.
in the process of dealing with obesity.
And I wanted to ask you about some of the risks which you referred to, but I guess that's one of them, right? Is that people almost see it as like a silver bullet or something. That's something that's going to fix all of their problems. But what are some of like the more acute, like medical risks that can come from taking these drugs?
Okay, so there are some gastrointestinal issues that come with using them, but these tend to fade away. So like nausea at the beginning, especially when you are starting the drug, and you start at a low dose and then you titrate up, and so each time you jump from a dose, feels really weird. So you will suffer from nausea, diarrhea, constipation. It can be a bit uncomfortable, but these symptoms tend to calm down and get under control as your body accustoms to the effect of the drug. Then you've got some more some rarer risk. Some that have been more seen on rodents, and they're quite rare, but you can have a risk around acute pancreatitis. At one point, we were worried that it would increase the risk of thyroid cancer, but that I think is only been seen on rodents. But nevertheless, the dropout is high. So a lot of people will, within a year, I think it's between 60 and 2/3 of people who start using GLP-1 will stop within the first year.
Okay.
Yeah, so I mean, just building on what Clem said there. So I've got a fair few clients now who are on it and are specifically coming to see me because they're on those drugs. Nausea, really, really common. Dizziness as well. Fatigue, some kind of, sometimes you get kind of muscle and joint ache as well, which, although can be very unpleasant and uncomfortable. Again, if you're weighing up, losing severe amounts of weight compared to some nausea and muscle ache, it's probably still worth taking it, but obviously that depends on the person. Aside from that, so those are the kind of medical side effects. We also have, what we know is that when you lose any amount of weight, whether you're doing the drugs or not, but particularly because this is such rapid weight loss, a large amount of the weight you lose comes from lean mass and lean tissue as well. So the research varies, but it's shown that anywhere really between 20 and 60% of the muscle and of the weight you lose can come from bone and muscle mass. Now that has its own issues, things like increasing frailty, increasing the risk of fracture, osteoporosis, osteopenia. All the things you can basically think of that affect quality of life are really severely impacted. And again, just to reiterate, that's not specific to the drugs. If you were doing a regular weight loss calorie cut or whatever means you were doing that, that's always a risk that you lose muscle mass as well. But because people are losing so much weight so quickly, that can increase the amount of lean tissue we lose. So although people are losing weight on the scale, their composition isn't changing too much. They're getting smaller, but they're not actually improving their health in any way. And then what we do know as well is that when you stop taking the drugs, at least at the moment, if you haven't really done any lifestyle changes, then actually you put the weight back on really quite quickly. And if you've lost a severe amount of bone and muscle mass in that time that you were losing weight, and then you've put on fat quite quickly, you're in a worse position than you were. You're now made up of more fat, and your bones are weaker and your muscles are weaker as well, right? So that's as building on what Clem said before about that holistic care. It's just one part of the tool. It's not the magic bullet that is going to take care of everything. It's so important to know the risks that come with it as well.
But and I think the risk around sarcopenia, the loss of lean tissues, is real, but it's preventable.
Yeah.
So I think it's really important because there is a bit of again in the media say these drugs are dangerous. You're going to lose all your muscle mass. Yes, if you are not doing all the right thing. But like Tom said, it's the same case with any dramatic weight loss. If you go on a very low-calorie diet, you will see the same effect. It's more dramatic with GLP-1 because you are, you mentioned losing weight very quickly, but also losing so much weight. You're pushing your body away from your what we call your set weight so much that actually when you stop the drug, it bounces back quite quickly, a bit like an elastic band. The more you pull on it, the more as soon as you let go of the elastic band, you're going to put back the weight on, and because your body will want to go back to what it's comfortable with, which is your genetically predisposed natural weight. And there is a risk of you gaining more fat if you're not careful, rather than just fat and lean muscle. Lean tissues.
Yeah. So I think obviously just how like much space that these drugs are taking up, like in the media, and like how much people are interested in them, even if they're not necessarily on them, speaks to like a couple of things, right? Which is that people are aware that maintaining a healthy weight, especially as we age, is really important to your long-term longevity, and that people are struggling to find sustainable strategies to maintain their weight. And we'll come to both of those questions as we go through the conversation. But I just wanted to kind of really drill down into what are some of the risks of carrying a high BMI or too much body fat as we age?
So you mentioned BMI, and yes, so we know that there is a clear correlation between high BMI and life expectancy. In fact, BMI was conceived by actuaries who were
Of course it was, yeah.
So, of course, what they were interested is, in that big data set that I've got, how can I quickly assess whether this population is at risk of dying quickly? And they said, if I combine body weight and height, this is, here we go. So the link is embedded in the metric. But what is interesting but we know that BMI for an individual doesn't give us much of an insight on their health. What is more important is your waistline. Your visceral fat is a predictor of your life expectancy and your risk of disease, chronic diseases. So if you think of, there is a very easy tool where you just take your waist divided by your height. If your waist is half of your height, then you're fine. But if it's above half of your height, then you're at much higher risk for your health and longevity. You lose years of life and years of good life, healthy life, with your waist, and that is because carrying fat around your organs, so what we call the visceral fat, your waistline, creates an inflammation, and as we age, we will have a bit more of this chronic low-grade inflammation. Something that is quite ugly, but we call it inflammaging, and that is feeds the dysfunction of a lot of your organs in your body, and will make it harder for your body just to survive properly.
Yeah, and kind of just building on that, that risk of having too much visceral fat and increasing the inflammation, that has severe knock-on effects to pretty much anything you can think of when it comes to reducing your quality of life. So things like Alzheimer's, things like chronic heart disease, things like cancer, risk of stroke, pretty much all the things that people desperately don't want. If you're overweight or over fat, the risk of getting those things is higher, right? So that's why it kind of I think people are these days, although we are interested in living a long time, we're actually interested in living a high quality of life. Nobody wants to live to 100 if the last 20, 30 years of your life are, completely dependable on someone else, and, you can't move, or, whatever kind of poor quality of life you have. You want to be able to do your activities of daily living. You want to be able to, wash yourself, dress yourself, go to the shops, do your exercise, see your friends. You want to have a high quality of life to be able to do that. And therefore, if you are overweight, the chances of having a high quality of life as you move into older age are reduced, even if you do get into older age in the first place. So, yeah, definitely don't want to be overweight if we can help it.
I'm going to come back to that BMI point because obviously, I'm learning a lot today, Clem. I didn't know that it was designed by actuaries, but that makes a load of sense. But is there maybe too much of a reliance on looking at that number and it's not kind of taking someone's holistic like health into view? So Tom, I'm particularly thinking of like, you might see somebody who's got a lot of muscle mass and they have a high BMI and they're healthier than somebody who
has absolutely.
A lower one, right?
So BMI is useful because it's a very, very simple tool that across a population can provide indicators of how healthy we are and the risk of dying. Because across an average, generally people with higher BMI are probably more likely to be overweight. But when it comes to the individual, that's not always the case. So someone with someone with a really high amount of muscle mass, they're possibly going to weigh more, which means that their BMI is going to be higher, and they might be in the overweight, or if they're really, really jacked, then they might be in the obese category according to BMI. But actually, if they're very, very lean in terms of fat, then actually they're really healthy still as well.
And to remember, the definition of obesity is where fat is posing problem for your health. So it's not any fat. If you carry lots of fat around your hips and your thighs, it's not a problem. But BMI doesn't even capture that. And that's why waistline is more interesting than BMI when it comes to the individual.
Yeah. So you can see why organizations like the NHS use BMI, because they're dealing with the whole population and they want people to be able to look after themselves, and it's a simple tool. But getting into the nitty gritty, something like a body composition assessment, whether that's what the gold standard would be on a DEXA scan, but even if it's on impedance scales or skin calipers, whatever it might be, getting an actual breakdown of what your body composition looks like is way more accurate. But again, it's not as easy at all. You have to go in and get an assessment for that to be the case.
I would say that BMI can be useful just as a quick screening tool. You just say, but then you investigate and you say, okay, could there be a problem here? And then, but you're right. Somebody can be looking very skinny and low BMI and actually have some visceral fat deposit around their organs, and that can be problematic.
And you say that about low BMI is an important point as well, because I think probably an area that doesn't get much focus with these drugs at the moment is people who are already dealing with low weight issues as well. So obviously a lot of people have eating disorders or history of disordered eating, and access to GLP-1s is only going to exacerbate that issue as well. So we don't want these falling into the hands of people that don't need it, and that includes people who are underweight as well.
And I'm just thinking now, as we kind of think more towards people who are trying to lose weight sustainably, Clem, how do you help clients kind of maintain their key health markers, make sure that they're kind of retaining their muscle mass and other key health indicators while they're losing weight?
Yeah, and so for me, if we come back to GLP-1, they are a fabulous tool because they create that window of opportunity to focus on what nourishment is, without to have for their efforts to be constantly undermined by this food noise that reminds them you want to eat. It's hard to not eat. I mean, I often think of because a lot of people will say, "Oh, weight loss is just a matter of willpower," and we know that it is not the case. Willpower, you can deploy it when you are running a marathon, and in the last few kilometers you're tired, but I carry on, I'll make through because there is an end. But when you have to constantly hold back on and living with the feeling of hunger, that nagging thought, there is no end to it, and so it's impossible. And these drugs, they offer you that opportunity not to constantly feel ravenous, and as soon as you're a bit tired and by accident you say, I need to grab something. I I just feel like what we've expected from people was almost inhuman. So for me, these drugs, when somebody has tried losing weight through diet and for health reason, and have struggled they often manage to lose weight, but the problem is that they gain it back straight away. These drugs offer you that place where they can just stop thinking of nutrition as calorie restriction, but think of nutrition as nourishment. And then we focus, okay, what is it that your body really needs? And then we can talk about protein, we can talk about fiber, we can talk about chrononutrition, we can talk about behaviors that are going to help you making sure that you achieve your goals. But the fact that we don't have, on top of that nagging thought that keep banging and say, feed me, feed me, feed me, is an amazing place for us to be.
Yeah, I mean, you've basically got hundreds of thousands of years of evolution working against you, haven't you, really, when it comes to trying to resist the urge to eat. Yeah. From a training perspective, so we've touched on it already, the importance of making sure that we're limiting the amount of muscle and lean tissue wastage, essentially. So when it comes to training, the key thing there is resistance training. So if someone is losing weight, then it's really, really important that we're trying to at least slow the loss of muscle mass, or at least try and maintain it as best we can. When you're in a severe deficit, it's very hard to build muscle, but you can maintain it as much as you can. So, and that looks like, something's better than nothing, but the evidence will point towards 2 to 3 times a week of resistance training. So it's one of those things. I'm a big advocate for that people should be doing something they enjoy when it comes to exercise, because we want to build sustainable habits and everything we spoke about last time we sat down. But really, as kind of more and more research comes out in terms of long-term health, there just really isn't anything that can replace the benefits of resistance training. So whether that looks like a home workout, whether that looks like going to the gym, even if you're doing it just kind of 30 minutes a week, fitting it in, micro-dosing it into your week, some kind of resistance training, some kind of strength training is the real key for managing that lean tissue loss. And particularly when it comes to bone loading, things like landing and jumping in a safe way that you can tolerate shocks the skeleton and helps to regrow those bones stronger as well. So obviously that doesn't mean jumping off buildings, but from safe heights, from manageable heights, or just jumping up and down on the ground, that can really make a big difference in preserving that bone loss. And I think, kind of touching what Clem was said there in terms of nutrition, which obviously isn't my area, but with people reducing their feeding, they're eating less and they're eating less frequently. I guess it's really important that when they do eat, they're maximizing the nutrition they get.
Exactly. Right? So every bite counts suddenly. And of course, from a nutrition standpoint, we will want to make sure that they get enough protein. But protein on its own is not going to preserve your lean mass. You need to do the resistance training. That is the first foundation. And then you can just say, let's make sure that once you've primed your body to create more muscle mass, then we bring the nutrient that is protein to help building it. Priority to the resistance training.
It's at the point really where if anyone is being prescribed or is doing the prescribing of these drugs, it absolutely 100% as a non-negotiable must come with prescription of exercise too. So if a GP is prescribing someone to jump on or to start taking Mounjaro, then it should be without doubt that they're also saying, and you should go and see an exercise professional as well to kind of get started with that exercise, because otherwise you're at risk of all the things we spoke about.
And I'm sure this is really common for you two to be working together on something like this within an MDT, right? Strength and conditioning coach, a nutritionist, someone's probably coming in and saying, I want to gain muscle and I want to lose fat, but then these drugs are maybe adding in an extra element. So has it actually changed the way that you refer to each other, or is it just more of the same, but just with this added caveat, I guess?
I think it's the caveat really now is that in the past, if you got someone who's overweight and looking to lose weight, then maybe a big part of the training that they do will be about getting them moving to try and stimulate energy expenditure. And assuming they're taking care of their nutrition, then hopefully that would equate to losing weight. Now, when it comes to the training, we don't need to worry about them expending energy. They will lose weight. The drugs are very, very effective. If you're taking them, you will, it's pretty unequivocal. You will lose weight. So when it comes to the training, we don't need to think about, right, we need to get you moving loads to kind of continue and speed up that weight loss. It's happening anyway. It's way more about, we need to build that lean mass. We need to maintain that lean mass. Yeah. So there's a difference to the programming there, which actually is often more enjoyable, I think, because people who may have struggled with their weight, the idea of going in to a gym environment and being shouted at by a trainer that they just need to basically move as hard as they can for an hour is fun for nobody. Yeah. And actually now we don't need to do that. We can maybe possibly even bring down the intensity to an extent, because when it comes if the goal is to build muscle and bone, it doesn't need to be that high heart rate, high intensity exercise as such. Of course, we still want to improve people's cardiovascular health as well. That goes without saying. But with that specific goal in mind, actually, people are sometimes pleasantly surprised that you can come in and you're not just crawling out the gym afterwards.
Mm-hmm. And in terms of how we work together, I think in the conversation that we have with the patient, it's clearer how important are the two pieces, and so and we can explain it very eloquently, very clearly, so that people say, oh yes, I can't just focus on one. There was a time where people would say, I'm going to lose weight through exercise and I will forget about the nutrition, or I will focus only on nutrition and because I don't want to do exercise. This is not possible anymore. You really need the two together. They reinforce each other and they support each other.
Yeah, I think a couple of years ago, it became a bit more, I think someone said it on some podcast, but it became a bit more known that actually if you're exercising to lose weight and not taking care of your diet, actually it makes no difference, which I think upset a lot of personal trainers out there because it's basically their livelihood. But it's true, like you can't do one. If you're just exercising more, your body will just get more hungry and then you'll just eat. So if you're not taking care of the nutrition, then you're not going to lose weight. And if you're only focusing on nutrition, then actually your body composition is going to change as well. So yeah, both come hand in hand, which again, kind of repeating what we said, it's that holistic approach is needed. Whether you're on these drugs or not, when it comes to your health, you need kind of input from every angle. Yeah. Input from every angle.
And are there any, I'm just maybe thinking as well, while people are losing weight and the reduction of the food noise and all this kind of stuff, is there a chance that they'll be missing out on certain micronutrients as they change their diet? So how important is supplementation?
So before I jump onto supplementation, I want to reinforce that I talked about the importance of protein and every bite counts. So we want to really pack nutrients in every mouthful. But there is one thing that is often forgotten, is fiber. So fiber is going to help with your digestion, and it's also going to help you live long term and protect you against lots of diseases, and it will reduce the inflammation that I was talking about. So very important not to ignore fiber, but eating fiber becomes harder when you are on GLP-1 because it fills you up quite quickly, and so does protein. So especially if you are in the rapid weight loss phase, you might find it really hard to eat fiber-rich food. And so we need to find ways just to make sure that the diet provide all of these things. In terms of supplement, there are I would say food first always, but when your appetite is severely reduced and suddenly you eat very little, it may be a good idea to take multivitamins just during the rapid weight loss phase, just to cover your back. It's not a long life insurance, but it may be useful during this the first year where you are doing the weight loss. And then after, you need to be careful of things like calcium, vitamin D, but that is on the case-by-case basis. You will just look at the quality of the diet and assess what they may be lacking of.
Yeah, I think I get asked about supplements a lot, and there's a lot out there. What is it? 1.6 grams per kilo of protein? Is that
1.2, 1.6. Yeah.
1.2, 1.6. So
of ideal body weight.
Yeah.
Yeah.
Exactly. So people often ask about protein, and protein shakes in particular, which I'm an advocate for.
Yeah,
but
absolutely.
Had one this morning.
As did I. So they're really good to top up if you feel like you're not getting adequate amounts in your whole foods in your diet.
Yeah.
I think the risk when people are on these kind of medications is that they think, I need to pack in loads of protein, but I feel like I can't eat that much. I'll just have a protein shake. Now, although you'll get a good hit of protein from that, you miss all the other, as you said, the micronutrients and the vitamins that come with eating whole sources of protein. So it's important that we don't just kind of, as Clem said there, kind of rely solely on the supplementation. It's important that we are kind of well-rounded diet from our meals, even if they are in smaller quantities. But if we feel like we are struggling, then that's when those supplements come in. Something useful. Like protein is good. Creatine can be useful as well. So creatine, again, rising in popularity, very well researched, and has shown for some people you get small increases in lean mass as well when taking that, with very limited kind of risk of side effects. As to my knowledge, there aren't really any risks.
Safe.
Yeah, creatine's very safe. So the worst case scenario is it doesn't do anything. But for some people, it means that actually you're a little bit stronger and you build up some lean mass as well. So those are the kind of two that I recommend. Vitamin D, as Clem said as well, most people in this country, especially through the winter, are deficient in vitamin D. So worth taking every day as well.
And Tom, I wanted to circle back around to something that you said, that like as people are losing weight, and especially if they're maybe taking some form of weight loss drug to help with that the prescription of exercise or supplementary exercise programs can really help people. Is that really important as well, say if you're aging as well, right?
Yeah, everyone should be exercising. It's again, we were speaking about that longevity earlier, and longevity and health span. Exercise is really the foundation of that. So yeah, as we get older, so naturally from the age of 30, 35, we start to lose muscle mass and bone mass generally, and our fitness starts to decrease as we get older. So it's important that we try and slow that, and that's whether we're losing weight or not. That's just part of aging. But if we are exercising correctly, then actually you can slow that loss. So yeah, absolutely. People who are keen to be able to live healthy into their old age, to be able to spend time with their friends, their family, and if they want to keep working, whatever their goals may be, really they need to be exercising as well, which is good because a high proportion of my client base these days are people in their 50s, 60s and 70s, because they know that they need to be exercising, lifting weight, reduces the risk of injury as well. So those kind of aches and pains that people get as they get older, that can be reduced.
Cognitive health as well.
Yeah.
It's a huge factor in good cognitive health.
Yeah, exactly. Yeah, kind of keeping
So the
you mentally
benefits
sharp
are
as well.
Quite undeniable.
I mean, a big bugbear of mine, speaking as a 28-year-old, so with no actual knowledge of what it's like to be this age, but I think in society we kind of have the perception that once you hit 60, 65, it's kind of you've crossed into I'm old now. So any kind of ache or pain or issue that arises, it's just, what can you expect? I'm at this age. And, I'm just going to have to, this is something I'm going to have to deal with now until I meet my end. But actually, if you do the right things, we have enough research out there now, and there's enough evidence to show that if you do the right things, especially as you're in your younger years, but the best time to start is now, whatever age you are. But if you do the right things, actually, you can live a really high quality of life into older age. And there's no reason why 60 is not just 2/3 of the way through your life. So yeah, and again, and we're saying doing the right things, but a big part of doing the right things is exercising. And again, that doesn't mean you got to go out and absolutely beast yourself 5 times a week, but it's, going out and making sure you're getting enough steps in, trying to lift some kind of weight a couple of times a week. Those are all the kind of really important things.
And you don't need to be Brian Johnson either. And
no, biohacking. Exactly. And inject blood into. No, you don't need to be doing that. And that, it's so. Yeah, I mean that's the extreme end of it, but it's.
At the end of the day, it sells you supplements, huh?
Yeah, it's trying to get cash out of it somehow. But no, it's you've got, that's the kind of one end of that kind of longevity space, and then at the other end, which is the kind of simple but evidence-based stuff, are things like exercise, things like nutrition, body composition, which we've touched on, things like balance as well. So we haven't mentioned that a downside to losing muscle mass is that it's harder to keep your balance, and balance increases the risk of falls, and falls is a big cause of mortality in this country. You're much more likely to, or your life expectancy reduces drastically if you fall and fracture, which again is another downside to having weaker bones. So making sure that you've got strong balance, making sure that your lung function is good, so your VO2 max, which is a topic for another day, but your ability to utilize oxygen, all of these things, they're the kind of more, I think, reasonable end of the longevity continuum, with injecting your son's blood and all of that other jazz at the other end of it. Not a service we're providing yet.
And Clem, I wanted to kind of maybe talk about that from a nutrition's point of view as well. Like, obviously, people, again, something that pops up in the media every once in a while is something like a blue zone, where you have to start eating like this tiny, the people in this tiny village in Japan or Greece. And are there any learning points that you can take from things like that, or is that again a bit like the injecting your son's blood side of things?
So there is a lot of things that we can take from the diet of the Okinawa diet, or the Sicilian diet, or just on the blue zone, a little anecdote. Again, there was this study that was published that completely debunks the concept of blue zone.
Oh, really?
By saying, look, these are places where either there were no birth record left because of the Hiroshima and bombing that destroyed all the records, or there are places where there is an incentive not to tell that somebody is dead, because then you keep receiving their pension. So it knocked a bit the image of the blue zone. But having said that, there is still some, from a mechanistic point of view, and actually we know there is a lot of research that's showing that a Mediterranean style diet is linked to longevity. So I would say when you think of health span, so not only adding years to your life, but adding life to your years, having this quality of life. First thing, you want to keep your waistline on check, and you avoid alcohol, minimize alcohol. It's really not good for you, despite being very pleasant. I would also say that have enough protein so that you can support your muscles, but more importantly, eat a lot of plants. Plant-based food. Plants are going to give you a whole range of nutrients, particularly a wide range of fibers, a wide range of polyphenols and antioxidants, and all of that is really looking after your gut. And your gut is going to, if you've got a healthy gut, you are really improving your immune system, and then you're reducing your inflammation. And so I think we need to think about that when we eat for longevity.
Yeah, I think, the point you made about the blue zones, kind of being a bit skeptical about it, is very valid. I think a pattern still emerges in those populations, though, that they tend to be more active generally, but and they eat more kind of whole foods and things, lots of plants, like you said. But they also social connections are really important as well. So I think there was pretty sure there was a big study out of Harvard a few years back that showed that if there was just going to be one thing that predicted someone's kind of quality of life, then actually it's their social connections. So the more...
So share your meals.
Yeah. Go to exercise classes, group exercise. Yeah, exactly. Yeah, but it's, loneliness kills, essentially. So maintaining strong relationships as we age is really vital.
Yeah. And like a problem, in a way, like a problem shared is a problem halved as well, right? So if you've got a friend who wants to go out and do a bit more exercise, get them to like do the couch to 5K with you or something like that.
Exactly. Yeah, and you get that, like you say, that social interaction, you motivate each other, all the benefits that come with that as well, hold each other accountable. And that's why, I have clients that they've been training a long time, and actually they probably could train by themselves, but actually they like coming in, they like the motivation, they like the social element that it gets in their day as well, and it provides them that different type of health benefit, I guess.
So obviously quite a wide-ranging conversation here that's touched on lots of like social issues and like individual like health problems and stuff like that. But I guess where I'd always like to leave it is to give someone a piece of advice. And I guess the advice would be, or the question I'd ask is, you have a new patient who's come in, they said, I want to lose a little bit of weight, but I don't want to lose my muscle mass. Like, what would be your one tip for them to go away with?
You put me on the spot.
Yeah.
I would ask them, okay, what does it mean for you? Okay, what will you gain from being to that place where you want to be? Picture that. And just because it can really clarify what really is important for you, and what motivates you. It's really about getting into exercising and eating well. If you are not familiar with that, can take requires a lot of cognitive load and a lot of decision making, and sometimes you might get a bit tired of making all these decisions. But if you know that it's going to serve you for something that is really meaningful for you, you're more likely to persevere. And it's about knowing why things truly matters to you.
Yeah, I think that's a good point. The reason people are overweight or maybe overweight is widespread. There's loads of reasons. It's not just because they have no self-control or anything like that. It's loads of things that can be attached to, comfort eating and using it as a protective thing. And again, way too much to get into now. So understanding, or it can be pretty heavy, but why is it that we're in the position we're in? Because actually, until you address that, then actually you're just, putting a plaster on it without actually addressing the issue. But anyway, I digress. To answer your actual question, in terms of if you had one piece of advice for someone that wants to lose weight but do it healthily, the first thing I always say is kind of look at how many steps you're doing, basically. All phones and wearables these days track how many steps you're doing, and chances are probably not doing enough. And so even if you're doing 1,500 steps a day on average, if over the next couple of weeks you can get that up to 1,700 or 2,000, you're already making positive changes to your body composition, to your cardiovascular fitness, and to your weight as well. So that's, I always think, and for most people, hopefully, that's an achievable thing to do.
Small, manageable.
Yeah, exactly that. So it's small, trying to be a little bit better each time. Again, 10,000 steps is thrown around as the golden number, but if you've got someone that's on 1,000 steps a day and you say this needs to be 10,000, you're never going to see him again. So it's kind of bridging that gap. What small changes can we make? And often steps is something that's manageable for a lot of people.
I really like that.
Good place to leave it on then. Clem, Tom, thanks so much for your time.
Pleasure.
Thank you.